Social Security benefits for depressed individuals. Depression. This mood disorder affects millions of Americans every year. Men, women, adults, teenagers, and children of every race suffer from depression. Individuals afflicted with depression experience emotional, social, and physical disabilities that prevent them from leading normal and happy lives. They experience feelings of guilt, worthlessness, shame, extreme sadness, lethargy, extreme exhaustion, and much more. Even though it has become a well-publicized disorder in recent years, and there are a wide variety of treatment and support organizations available, a majority of people suffering from depression do not receive the help they need. People deny or minimize their suffering. Others try to cope on their own. As a result of emotional hardship and physical disability that plagues them, individuals with depressive disorders face financial problems. According to Dr. Bob Murray and Alicia Fortenberry, depression results in more absenteeism than almost any other physical disorder and costs employers more than $51 billion per year in absenteeism and lost productivity. Depressed individuals have extreme difficulty in simply getting out of the house or even out of their beds. Going to work and functioning productively is monumentally more difficult. Individuals with severe cases of depression can qualify for Social Security disability benefits if they meet 4 or more of the following criteria: lack of interest or pleasure in most activities, decreased energy, poor appetite or overeating, insomnia or oversleeping, difficulty concentrating or thinking, lack of physical movement, feelings of worthlessness or guilt, paranoia or delusions or hallucinations, or suicidal thoughts. In addition, they must experience difficulty in daily activities, social functioning, and focusing. Individuals that qualify receive Social Security benefits that support them financially where they cannot support themselves. This seems to be a benefit. However, simply receiving monetary support does not encourage individuals to seek help. In fact, it may encourage their lethargy and withdrawal, since they would not have to work to support themselves. To correct this, the Depression and Bipolar Support Alliance should advocate the requirement of continuous treatment for people receiving Social Security benefits due to depression, because it will ensure that they receive the support they need, the information relevant to their disorder, and the appropriate treatment for their condition. Requiring treatment for recipients of Social Security benefits due to reasons of depressive disorders will ensure that they receive badly needed support. According to the National Institute of Mental Health website, major signs of depression include persistent sad, anxious, or empty feelings, feelings of hopelessness or pessimism, feelings of guilt, worthlessness, or helplessness, and thoughts of suicide, among many other symptoms. Lack of social support from friends, family, and others not only intensifies these feelings, it also causes them. As stated by Alicia Fortenberry and Dr. Bob Murray in the article Depression Facts and Stats, chronic or lifelong endogenous depression is caused by trauma in childhood, which includes emotional, physical, or sexual abuse, yelling or threats of abuse, neglect, even two parents working, criticism, inappropriate or unclear expectations, maternal separation, conflict in the family, divorce, family addiction, violence in the family, neighborhood, or TV. All the causes listed above can be attributed to a lack of some form of support, often within the family. Abuse is associated with a lack of emotional and social support, and neglect goes even farther by removing physical support as well. Other causes exist that can predispose or contribute to depression, such as biological causes in the form of inherited personality traits and neurotransmitter levels, or environmental stresses. But psychological causes Fortenberry lists are agreed upon by many psychologists to be among the strongest roots of depression. The most common forms of treatment for depression are medication, usually antidepressants, electroconvulsive therapy and other brain stimulation treatments, and psychotherapy, typically cognitive behavioral therapy and interpersonal therapy. Treatment effectiveness varies with the individual and is often tailored to their symptoms. However, one of the most widely used methods of treatment is psychotherapy. Part of psychotherapy is the development of support systems. According to Fortenberry and Murray, studies show that relationships with partners, caregivers, teachers, co-workers, and a supportive social network results in physical and emotional healing, happiness and life satisfaction, and prevents isolation and loneliness, major factors in depressive illness. Psychotherapy is claimed to be the most effective treatment for depression. In addition to giving patients an outlet for their emotions and guaranteeing critical human interaction, it helps establish support from family and friends. Talk therapy is a large part of psychotherapy, involving the patient being able to share all of their thoughts and feelings with their therapist without fear of judgment. The sad reality is that most people with depression don't seek help and therefore do not acquire the support they need to recover. Requiring treatment for depression in order to receive Social Security benefits will guarantee that those individuals receive the support they so desperately need. In addition to providing support, the requirement of treatment as a prerequisite for receiving Social Security benefits will also ensure that individuals with depression will receive information relevant to their disorder. The first step in treatment of depression involves going to a doctor. There, they will receive a formal diagnosis and often a referral to a mental health specialist. Once they have contacted a professional, the patient can learn information relevant to their condition. According to the Handbook of Depression, an important and often overlooked aspect of managing depression is education. This consists of providing the patient with information about depression in the context of their own history and experience. In order for the patient to be effectively educated about themselves and their disorder, they must form a relationship with a therapist. Once they have established a connection, the therapist will take a personal history and assess the presentation of the disorder in the patient. In doing so, they are able to share the information the patient needs in order to be treated and to recover. As most people suffering from depression will not seek out therapy on their own, the requirement of treatment will help them form a relationship with a therapist and will ensure that they get the information they need. Requiring treatment will ensure that individuals receive the appropriate help for their condition. As discussed in the Handbook of Depression, this treatment will reinforce the education and support. Interpersonal therapy is a psychoeducational intervention because, in addition to the strong social emphasis, therapists teach patients about depression and its treatment. This includes providing practical advice or recommendations to help patients better tolerate the symptoms of depression and manage impairments associated with the depressive state. Cognitive behavioral therapy also emphasizes patient education. Many forms of treatment exist for depression, and their successes vary from person to person. Antidepressants are often effective for less than half people with depression, and the success rates for electroconvulsive therapy and other brain stimulation techniques is also reported at low levels. Psychotherapies are reported to be among the most effective forms of treatment. In order for the most efficient treatment to be prescribed and for an individual to continue with that treatment, the afflicted person must form a relationship with a medical or mental health professional. As stated in the Handbook of Depression, it will be apparent that agreeing appropriate treatment requires evaluation of which treatments are indicated given the nature of the patient's illness, taking into account their individual characteristics, the ability of treatment, and their personal choice. Establishing rapport between the therapist and the patient is crucial to the success of treatment. Treatment is a continuing process, not a one-time cure. After the time required establishing a relationship between the patient and his or her therapist, more time is required for the treatment to take effect. This is supported by facts in the Handbook of Depression. It is well recognized that there is a delay between starting treatment and noticeable benefit. But contrary to standard teaching, it does appear that improvement can be detected in the first few days, and the greatest rate of benefit improvement, revealed by ratings of symptoms, occurs in the first 1 or 2 weeks. However, other aspects, such as function and sense of well-being, lag behind this, so it is often 3 or 4 weeks before the patient feels any better. Improvement with psychological treatment tends to be a little slower. Requiring treatment for the entire duration of the time in which the patient receives Social Security benefits will ensure that they have the time to develop a patient-therapist relationship and allow the treatments to take effect. It will also help to prevent relapses of depression. As stated in the Handbook of Depression, patients often also stop treatment when they start to feel better. It is important to emphasize that antidepressant treatment needs to be continued after improvement in order to prevent early relapse. Social Security benefits last for a good period of time, typically at least 3 years before a case is reviewed. Requiring treatment for the entirety of the financial support will guarantee that the individual receives treatment, does not discontinue it before they are fully recovered, and will prevent relapse. This will ensure that the treatment remains effective so the individual can fully recover. Social Security disability benefits are meant to help those in financial need due to circumstances outside their control. Individuals suffering from severe depression certainly fall into this category. They may have been biologically predisposed to the disorder, or they may have suffered psychological trauma or faced environmental stressors. Whatever the case, these individuals are not at fault for their condition, and they should receive the help they need, both financially and for their disorder. The Depression and Bipolar Support Alliance should advocate the requirement of continuous treatment as a requirement for the receipt of Social Security benefits for reasons of depression, to ensure that the recipient gets social support, education about their condition, and effective treatment, as well as financial support. This will help the many people who must rely on Social Security because they cannot support themselves, because they are so depressed that they cannot work, and it will help them once again to lead happy and normal lives.